Well, that was when drop when you went red.
Because my house is in James, do you not know that the whole I have the sofa straight and the tank and then they give me the sofa appointment for and one day Jack said, oh, why don't you buy a house of your own? My house, I'm I was just trying to replace the
How are you doing?
Alright. You're chicken.
See, I'm always around you though.
Every time you're eating chicken. I get it in the morning. I was sitting between Conrad and we're standing out. Yeah.
Yeah, no, exactly. No, just outside.
They would have the experience,
Hi everyone. We started at 3:15. Please get yourself some food, some drinks, and we'll start in about 5 minutes. Okay? Or maybe and actually, yeah, oh, because no, we're not. So yeah, we just announced it was starting. Yeah, yeah, and we're okay, okay. Are you Angela? Yes, nice to meet you. How about you? I'm so nice to meet you. Have you met Sophia? Yeah, nice to meet you. Okay, that's well to know. I told you she's there. So yeah, let me. How long? Alright. Okay. People, please start taking your seats. We're gonna get started. Hi everybody. Please welcome, welcome. Thank you. I guess it sounds right. Ladies and gentlemen, welcome, welcome. Well, thank you so much. Thank you everybody for creating time to join us in today's conversation. The conversation we are having about the future of health rights and overcoming pharma monopolies and the commercialization of healthcare. We are going to call our keynote speakers, and to start us off, we are going to have Fatima Hassan, who is the founder and director of the Health Justice Initiative. Fatima is the human rights lawyer and social justice activist and the founder of the Health Justice Initiative in South Africa. She was the executive director of Open Society Foundation for South Africa, and he has also worked for the AIDS Law Project. Welcome, Fatima. And Fatima's background, she's going to cover the role of transparency in the fight against pharmaceutical monopolies. Welcome.
Hi everyone. Amanda! Is this activists? Or is this, who are these people? Not UN officials. I just should tell you that the last time we were here, I don't even remember, but this is going to give away our age. But we were so angry as activists, and we came to UNGA, which in my view is a really pointless exercise, by the way, because it doesn't really materially change anything or anybody's living conditions. But as HIV/AIDS activists during the height of the crisis of when people in Africa and Latin America could not access life-saving ARVs, about 50 of us staged a walkout at the UN chambers when Kofi Annan was the Secretary General, and we almost all got arrested until he made a late midnight call, right, Robert? And said, no, okay, release the activists. So I think that our strategies for the way in which we challenge power across the globe has to, I think, bring back some of that radical action of the AIDS movement. Because unfortunately, there's lots of negotiations being done in our name and lots of promises being made, but on the ground, we're not seeing that translate into the actual realization of the right to health. So I've been given 3 minutes to talk about what just happened in South Africa. And if you haven't heard, we've just made a small dent in the secrecy of this pandemic. And so secrecy is a tool that is deployed by the pharmaceutical industry to extend their monopolies. It is deliberate, it is one-sided, it is a form of bullying of global self-governance, and it is anti-transparency. So if you are a CEO or a board or a shareholder and you believe in the rule of law, and at times you believe in transparency and accountability, I think the question we all have to answer in each of our countries are why are pharmaceutical companies signing secret contracts with our government? Why did they do that in this pandemic? What type of bullying was so pernicious that governments in the global south were held to ransom negotiations for very limited amount of supplies in a staggered manner, and in some cases we just found out in South Africa at a higher price than even what the EU or the US was charged. So what we have is a situation in South Africa where an NGO, ours, went to court using access to information laws, where we asked our government, not the pharmaceutical companies, because our government used our public money to disclose all of the vaccine procurement contracts in South Africa. And at the time when we launched the case, we were told that the negotiations were done in good faith. If we disclosed the contracts, we would be prejudicing future negotiations with the very same companies, mainly Pfizer, Johnson & Johnson. And also, as you all know, because this happened in Latin America, it happened in Africa, that governments were asked to sign secrecy clauses or non-disclosure agreements, which meant every single term and condition of the contract was a secret, including the contracting parties' details. Even that information was refused to be given to us, which is why we couldn't serve legal papers on the pharmaceutical companies and, wait for it, Gavi for COVAX. So this case actually involved 3 pharmaceutical companies and others. We're waiting for the rest of the documents at the end of this month. But the contracts that we received, it's on our website, it's unredacted. The court in South Africa ordered the full disclosure of all procurement contracts, as well as all negotiation and the remarkable thing, and we can all speculate why they did that, but even though our government fought the case for 2 years, and Nick, they even stood up in court and said we should pay for their costs and that the case should be thrown out. So when the president stands up at platforms, my president, well, not my president of my country, and talks about equity and talks about being a beggar and talks about vaccine nationalism, people should ask him why his government fought an NGO for 2 years and refused to make the information available. The good news, the silver lining, is that the Minister of Health about 2.5 weeks ago decided not to appeal the decision of what we call the Gauteng High Court. So it's a High Court, it's not the Supreme Court, it's not the Constitutional Court. And the fact that he did not appeal the decision meant that the government had to hand over all the contracts within 10 days, which they did. And we immediately worked with a number of civil society organizations. There's a multi-group analysis. There's about 11 organizations. Some of them are here with us. We worked on those contracts for 4 days. And on the 5th of September, issued analysis, which we have called one-sided, a case of farmer big bullying. And unfortunately, if you read those contracts, and I urge you to do that, and you read our analysis, you will see that what some government ministers and presidents were talking about in 2020, in 2021, in 2022, about the handle that CEOs of pharmaceutical companies had on our governments, that it is totally true. You will read those contracts and you will get angry and you will get upset because we spent about 11 billion rand, which is a significant amount of money, for supplies that came late. In some cases, supplies that never came. In some cases, supplies that we had to pay for even if we were not going to use those vaccines. The COVAX contracts didn't even give us certainty on volume and price. It didn't, give us a maximum price and maybe a minimum. Johnson & Johnson is now claiming the price in the contract is different to what they charge. There is even more confusion since the contracts have been disclosed. Pfizer is very silent. I've made an appearance in Johnson & Johnson's press statement. I suppose that's a good sign for activists. And COVAX has basically turned around and said, but we donated a few million vaccines. But if you look at the COVAX contracts, you were also liable as part of your advance payment to pay for supplies that one day you may decide you didn't want. Because you remember at that time everybody was entering into multiple bilaterals. But the worst of the provisions in this contract is something that is so egregious that pharmaceutical companies would never demand from the global north and didn't. So the EU had an export ban. The US government had an export ban. India had an export ban. But South Africa could not control exports. So, when we talk about voluntary licenses and everybody gets all happy and we say, watch that, and that is what happened in South Africa, a big PR spin around the Aspen license for Johnson & Johnson. But you will remember that when my country, people were getting sick and dying, wave after wave of infection, we were facing travel ban after travel ban after travel ban. 30 million vaccines filled and finished in my country by Aspen was sent to, guess where? Europe. Because European lives mattered more. So they didn't go to anybody else in Africa, they didn't go to South Africans. We waited for vaccines because the companies decided on the allocation. They decided on the geographical distribution of the entire supply chain. So the myth that voluntary licenses actually gives control to the generic manufacturing company, I think it's also become quite clear in the disclosure of these contracts. But the most egregious is that Johnson & Johnson said to South Africa, if you want vaccine supplies one day, maybe later, you will agree not to impose export bans so that we can divert supplies in a second separate contract with Aspen to benefit Europe. And we've heard similar reports about the UK agreement with AstraZeneca and Serum, where the UK was a priority customer. Now, for those of you who travel coach, you know what a priority customer means. It means the people who board the plane first because they have a first class or business class ticket. And that is what happened in this pandemic. There's also provisions around the confidentiality requirements, around the jurisdictions in which the disputes would be decided, ranging from Switzerland to the United Kingdom, to the laws of New York, to the laws of Delaware. So it makes it really difficult for governments in the global south to be able to challenge any of these pharmaceutical companies. And then finally, which we, some of us who worked on issues in Latin America are aware of, just very extensive one-sided indemnification requirements and obligations. So full protection against any civil or criminal forms of liability, the requirement to set up quick vaccine injury compensation funds, which if you didn't, would delay the delivery of supplies and they wouldn't countersign the agreement. The one funny story is there's no confidentiality clause in the COVAX-Gavi agreement, so we don't know why that was kept secret for almost 2.5 years. So I just want to, in the final part of this set of introductory remarks, mention two things. The contracts are open, it's unredacted, we will always fight for transparency because you can't have secrecy in public health. But the provisions in the accord around transparency on pricing and around terms and conditions are already, there are efforts to already water that down. And that lobby is coming from global north countries and from the pharmaceutical industry, because this is not the kind of PR they want, right? There is worldwide reports about the bullying that happened in South Africa. This is pharmaceutical companies scrambling now to make sure that there has to be a different way for them to be able to keep their content secret. And when you don't have price transparency, we found out we would charge double for serums vaccine. We would charge more for Pfizer. We initially would charge even more for Johnson & Johnson. They now claim they charge us the not-for-profit price, even though their global not-for-profit framework is not available on their website. So the provisions, I think, are really relevant if that accord is going to go anywhere. And more recently, if you think this was a once-off and this only has to do with COVID because we were in a difficult time and in a public health emergency, MSF has refused to sign a contract with VIV on a really important HIV prevention medicine because they demanded or insisted that MSF must agree to a non-disclosure agreement where you can't make any of the terms public or transparent. So I think the question must be, how can we live in a world where the CEOs of pharmaceutical companies who are unelected officials, while private corporations are getting to determine whether governments can make this information public or not? And then the final point is that it's not just the contracts that we fought to open. We hope that access to information activists around the world will start using creative ways to also open other contracts. Our comrades in Colombia have done a brilliant job to get unredacted versions of their country's contracts as well, but there's heavily redacted contracts in the EU and in the UK and in the US, and we need to open that. We need to blow the lid of secrecy. But aside from the contracts and what you agree to in our name with public money, I think there has to be more work done around pricing and around evergreening. And there are other colleagues who can talk about that. But again, just in the last few days, and so it's really good timing, and it's the same company, Johnson & Johnson. The competition authorities in South Africa have announced that they are now investigating formally Johnson & Johnson into two aspects of its TB drug, Bedaquiline. The price, which is one part of it, and the second is its evergreening patent conduct. And I think that that is really significant if you're talking about transparency from multiple angles. Thank you.
And having heard from the human rights activists, some of the areas that actually Fatima's spoken about is the negotiation at the ground, negotiations which are hidden and whereby things on the ground are different, whereby some farmers are signing secret treaties, which is not like the right thing. Now we hear from the government, and we are going to hear from Ethel Ria, Secretary for Health, Surveillance and Environment at the Ministry of Health of Brazil. Ethel was appointed as the Brazil Health Surveillance Secretary by President Lula. She holds a master's in nursing and PhD epidemiology from UERJ with a postdoctorate from Johns Hopkins University. Welcome.
Thank you very much. It's a very strong speech, and thank you for that. On behalf of Brazilian government, the new government, from President Lula, not the old one, but the new one. We are very much compromised with transparency, and we open all the contracts with the vaccine that we did in COVID-19 pandemic. And as you told, we pay a lot. We pay more than probably other countries that we even right now don't know how they pay. We pay $12 and in Brazil. And you can imagine that for one country with more than 200 million inhabitants, that everything is free of charge, the size of this bill. It's impressive, and the pharmaceutical company has a lot of profits with with the pandemic and what's happened with our countries. And I think it's for the human rights movement that I came from. Either right now I'm in the government, but I'm a activist in TB research field, and I used to be the president of TB Research Network in Brazil. So, and I became part of the government right now. But it's very important to us to discussing with intellectual property. This is a very important area for us. And when we are discussing now in the high level meeting with the PPR, this should be a major concern for us, because in the next pandemic, what the intellectual property will do for our countries, the area that we will face because of that. So it's important to put this, and for our part as the government, it's very important to put funds in the local production, because without that, we are facing the same problem all the time. So in Brazil right now, the major priority is to invest in the local production. As we know, we have Fiocruz and Butantan, two important institutes that produce vaccine. And we are right now making this sustainable, because sometimes you have to invest in something that probably you don't use, but you have to prepare for that. And right now, in these two major institutions in Brazil, we are investing in making this new technology available for new possibilities of vaccine, as vectorial vaccine and RNA vaccine. So this is our major proposal right now in Brazil. And of course, as you probably all know, Brazil was the first country that made the HIV medicine free of charge for every person living with HIV. So we are very proud of this, and we made this is not the government on that time don't give this for people. This is a human rights movement that forced that, and we think this audience is very important, and this because we, as the Brazilian government, are here today to say the importance that you have in this high level meeting that we are discussing here, because without the civil society, the human rights movements, you cannot push the government to do what we have to do. So your task is very important, and Brazil, as the president of G20 right now, and the presidency of the BRICS in the next January, will be, I think, the perfect window opportunity to make this I think this major task in the field of the geopolitics topics, to put domestic funds, local production, and intellectual property as the major discussing on the table to human rights, to civil society, to the government, and for us to work together to have at least one world less unequal and with more social justice. Thank you very much, and I'm open for your questions.
And we're looking forward for the discussion on IP and local production, which is one of the issues that we are so keen about. And now, a warm appreciation for our two guest speakers, Ethel and Fatima. We had a round of applause for them for the good job that they've done. And now at this juncture, we are going to welcome our panelists to delve more on the topic on the future of health rights and overcoming pharma monopolies and commercialization of healthcare. Could we kindly have Nick joining us on the panel? And next, to be followed by Marinette. Could we have Zachariah joining? Rosia? And finally, can we have Harry joining the Let's just start us off. We are going, this year's UN General Assembly provides a context of spotlight how at this critical juncture the world remains out of the track when it comes to achieving UNC by 2030. Civil societies must mobilize to ensure the slogan "Never Again" manifests in more than just words. For the world to have any hope of achieving UNC's strong, well-resourced public healthcare system that's equitably, universally accessible, gender transformative, and free at the point of use. We are going to ensure that we have like domestic and global health strategies in place, including pandemic preparedness, prevention and response. And meaningfully, conditions must be placed on the pharmaceutical industry to curtail their monopoly on access to medical innovation and extractive development finance institute investment that prioritize profits over patients prohibited by government and other stakeholders. And that brings us to our discussion today, and we are going to call on Nick. Nick has areas of expertise, which is pharma, monopolies, corporate, extractivism, challenges posed by the trade deals, and rules linked with the climate change. And that brings us to our first question, Nick. Do you think our current model of global health and the pharmaceutical industry serves the public health needs?
Thanks very much. Thanks for inviting me. I don't think it does in any way at all, and I think we've already seen from some of the from Fatima and the Brazilian minister why it doesn't through looking at the pandemic, through COVID, through the fact that the countries least able to afford vaccines and least able to get them were given much harsher and more stringent terms and actually had to pay more for their vaccines than the richer countries do. So it's one example, and I think that this model has always failed global south countries because the incentives built into it to produce drugs that maximize shareholder value, that incentive is never going to produce drugs that deal with diseases primarily suffered by poorer people or people in poorer countries. But I have to say, I think even in rich countries, the way that the pharmaceutical system now works is creating major contradictions with our own health systems. So here in the United States, people are only too aware, I think, of the astronomical profiteering that pharmaceutical corporations are doing because you are not protected by a national health service in the way that I am, and so the prices are evident for all to see. But even in our country, the price paid by our national health services in Western Europe for new generation drugs is absolutely astronomical. And the real shocking thing there is these drugs are created, invented, or 9 times out of 10 at least, with public money, by universities, by small biotech companies, and with large amounts of state support. And so it's absolutely shocking that that knowledge is then privatized, monopolized, by a set of very big corporations who are then able to charge astronomical amounts of money to the very people that have paid for them in the first place again. Something has to change. Not only if we're thinking about our ability to get medicines and drugs in the next pandemic, but in terms of our ability to get the drugs that are going to treat long-term chronic conditions over the next 20 or 30 years.
Sorry, we have to shift the mic.
That's okay.
Thank you so much, Nick. You've talked about one aspect that we need to look at when it comes to drugs being created by the public money and the public not getting access to this money, to the drugs, sorry. And that brings me to my questions to Marinelle. Marinelle expertise is when it comes to struggle for climate justice and parallels with the lack of global solidarity when it comes to COVID-19. And we're going to ask you a question related to crisis when it comes to climate and also when it comes to the pandemic. So my question goes to crises like climate change and pandemic cannot be solved by single government. They require collective actions to push our leaders and the private sector accountable. If the pandemic was a test of the global solidarity required to tackle the climate crisis, how do you think the world would have fared?
Thank you so much for that question, and thank you for having me. I'm Marinal again. I am from the Philippines. I am a climate justice advocate. I would like to emphasize that while the COVID-19 was happening, the Philippines was still struggling with typhoons because we are in the ring of fire and we experience 21 typhoons per year. So when there are lockdowns, where while people are in their own houses, people were actually forced to go to evacuation centers, which doesn't have any rooms for women and men. So we're all in the same room together with 100 to 200 people because we were trying to save our own lives. So in that sense, there was no really equity because while we are fighting COVID-19, we're also fighting the climate crisis. And how can you expect these people to adapt and mitigate climate change or to follow the rules of COVID-19 when they don't have any house to go back to? So after that, we don't really have access to vaccine or even just proper health care. Those people have been injured by the tragedies or the typhoons didn't even have access to go to hospital or even just getting a painkiller. It was just sad that the Philippines, just like maybe any other developing countries, they were the last countries to get the vaccine, and most I would not want to speak on behalf of the other developing countries, but in the Philippines, we got the vaccine that was rejected by the developed countries. And when we go to these conferences, the big conferences like UNGA or COP, we are not allowed to get visa because our vaccine, because we are not allowed to get into the first world countries because our vaccine did not qualify for whatever they are requiring us to get. That is not entirely our fault. That is not even our fault because that was just the vaccine that was available for us that our government could afford because vaccine was really, really expensive. And for the developing countries, for the people in the rural communities, you don't have any other choice but just to get whatever is being offered to you. And so if we will not really figure out how to solve this climate crisis, we will have more and more pandemic. And I don't think that the Philippines is really prepared for that. I don't think if my generation would be able to still go to these conferences and raise our voice, because if our government will not be supporting us, the young generation, it will be a point where there's no representation anymore. So yes, that's correct. We need global solidarity, but we are lacking global solidarity and solidarity to the developing countries.
At some point, you'll be leaving us and going for another panel. And I think before you leave, let me just ask you the second question. Most of the richest countries have done the most harm. They have a monopoly on the solutions, which they refuse to share with the countries who are worst impacted. What do you think should be the way forward when it comes to sharing, which the minister just talked about, when it comes to IP and local production?
Well, we have to make rich polluters pay. We have to make them pay for reparation to the developing countries because we have lost so much. There are a lot of losses and damages that has this first world country or developed countries to be paid. What is just very interesting is that the first world countries are expecting the developing countries to transition to a just transition or to mitigate. But the Philippines is just emitting 0.35% of the whole carbon emission, while the hundreds of corporations are fueling mitigating country. We can only adapt. However, whatever we do, we will not be able to solve the climate crisis because we are not responsible. We are not the cause of it. It is the developed countries who have really used our carbon allowance so we cannot develop anymore. And if we will not have the solidarity, if the developed countries will not let the developing countries develop, then how can we have a climate justice? How can we have health justice? We need everyone to be on board, and we need to make sure that the polluters are accountable, and the first world countries will share their technological expertise to make sure that these developing countries will be able to adapt to the crisis that we have now. Thank you.
Thank you so much, Marinelle, and thank you for the insights that you just given us. And that brings me to another question. When you talked about we need everyone to be involved, and to Zakaria. Zakaria is the director of One Day Sooner Africa, and you participated in the development of some of these vaccines. And Africa, where you come from or where you live, sees like we have like over 100 outbreaks every year. Yet Africa produces only 1% of the routine vaccines we use. What difference would it have made to have more vaccines production in Africa?
Thank you very much for that question. And, you're absolutely right that currently the African continent accounts for, I think, the largest portion of the global disease burden. And unfortunately, our priorities currently don't reflect that because we are still just about 1% in terms of output. And maybe getting more specific towards the COVID-19 pandemic, I think something I have said a couple of times is when we sometimes talk about experiences from the COVID-19 pandemic, I think we have gotten so comfortable with statistics. I always think that we should sometimes move away from statistics, and within those numbers that we're reporting, that we are reading, remember that these are actually human beings. These are people with children, these are people with families, and even when you're reporting that, oh, one person died, remember that this is a person who has a family, who's loved, who has responsibilities. And the fact is, even one death that is preventable is not acceptable. If the death is preventable, it should not be acceptable, even just one. Now, thinking about what happened during the COVID-19 pandemic, I think it amounts to one word, an injustice, especially for the poor countries. I come from a country, I was in Zambia when the pandemic hit, and I had to watch, I had to see neighbors, people I know get infected, people I know died. And this is at a time when millions of vaccines were available in other countries in the global north. In some countries, they were even talking about booster shots. At a time when even our own healthcare workers could not get even a single dose, a single one. And these were frontline health workers who were every day expected to be at the health centers, expected to be at the quarantine centers, every day interacting and exposing themselves to the virus. Are these honestly acceptable in a world where we talk about solidarity, where we talk about equity, where we talk about equality? No, it's simply unacceptable. And you mentioned that I signed up to participate in a COVID-19 vaccine study. My reason for doing that was, for the most part, as far as I was concerned, and from where I stood, either you get involved or you keep watching people die. And that's our reality now. We are being pushed against a rock and hard place. So it reached a point where you thought, what can I do here? And for me, if it means putting my own life at risk, in the hope that another vaccine or another dose could be available for people in poor countries, that was a you believe in this? And could things have been different to your question? Could things have been different if perhaps there was more access on the continent or in other low and middle income regions? The answer is yes. Definitely the pandemic's global outlook would have been very, very different, not just on the timelines or the statistics that I mentioned earlier, but even the recurrence of some of these outbreaks and variants would have been prevented. Because of the sporadic vaccination that was going on, we were creating a world where it was ripe for variants to remain, mutations to occur because some of the populations were vaccinated and others were not. But we did not reach herd immunity, which allowed for more variants to keep on emerging as it were. So I think that if local vaccine manufacturing would lead to access, pandemics could be ended much, much quicker, and the preventable loss of lives could have been avoided.
Oh, thank you so much, Zachary. And talking about inequalities experienced by the global south countries and some of the issues that, the challenges that they went through to access some of these vaccines. And that brings me to Brazil, who has like an expertise in public alternative to big pharma, the mRNA technology transfer hub, the impact of COVID-19 in Latin America. What role is there for technology sharing programs? And do you think do we have a different model for the big pharmaceutical companies in regards to some of the challenges that we are facing and solutions towards that?
There is a lot of space for countries in our regions, in Asia, in Africa, in Latin America, to advance regional capacities and to produce health technologies. That's actually something that the pandemic has proven us. At the beginning, the big pharmaceuticals were saying they're not able to, they can't do it. But then what we were able to see is that they were able, they had the capacity. For example, we have here the Secretary of the Ministry of Health of Brazil, and they have Fiocruz, they have Instituto Butantan, and they both were able to produce vaccines there. We also have Argentina, we have Mexico, we have Cuba, we have many other countries in LAC. We have countries in Africa who are able to produce. So what is lacking for us to actually produce in our regions? We are lacking proper financing. We are lacking to have better rules on intellectual property. And how can we advance that? For example, on the matter of financing, we have some opportunities. We can look at two ways to finance this. One is on the tax side. So when we look to taxes in our own countries, what we see is that they are very regressive. That means that we are taxing more the poorest ones and not the richest ones. So it's time for us to look to the richest ones and to the big corporations, to the big pharmas, and say it's time for you to contribute to. It's time to tax them. They have to contribute to the countries and to the people and to the nature. And also it's important to think that when we are investing in production of health technology, this is not an expenditure, this is investment. This is investment because there is something called multiplier economic effect. And when you produce medicines, what you invest returns to the economy in a higher level. So the amount that you invested on that is going to come back and even more. So it's going to finance itself and other rights too. And then of course there is the subject of intellectual property that the countries need to push so that they are able to advance this regional production without the restrictions that we have today. And actually, I'm really sorry that the secretary had to leave because she said we were able to open the contracts. The government, we civil society haven't had access to that information yet. So I myself made a request of information to the Ministry of Health in Brazil, and they have shared a lot of information about what Fiocruz and Butantan have invested. It's in details, it's something it's just one line saying, and the vaccines we bought from the big pharmaceuticals, they are closed. We can share the contracts with you. So that's amazing. And so we really would like to move forward with the same process we did in South Africa to open in other countries in Latin America the same contracts to advance this transparency.
Thank you so much. And in order to open this for many countries, we are going to talk about the impact of privatization on the right to health and global health inequality. What role is current international aid playing in enhancing and hindering UHC when it comes to privatization of healthcare?
Thank you for the question. So I'm here from Oxfam and I'm going to be speaking to a report that we've just published. Fantastic report authored by my colleague Anna Marriott, who's sadly not in the room with us today, but it speaks to these trends that we're seeing in global health architecture towards privatization and commercialization. So to your question about aid, what we know is that aid spent well and spent wisely is transformative, is life-changing. Ethiopia, for example, used aid to achieve most of the health-related Millennium Development Goals by 2015. But let's be very clear, development finance channeled via obscure private equity firms by wealthy countries using their development finance institutions that are providing vital public services only to the people that are able to pay astronomical fees for them is not that. Half of the world's population currently can't access essential healthcare, and little to no transparency in terms of the way that this development finance is being channeled is manifesting in investments in hospitals that are denying care and denying access to those unable to pay. In the worst cases, we're seeing the detention of patients that have been unable to cover the costs of these services, and we've seen profiteering throughout the pandemic as well. We know that achieving universal health coverage is not possible without a specific focus on reaching those on the lowest incomes. We need to upscale that access at a rapid rate, and we need to ensure that people aren't pushed into poverty as a result of trying to meet these healthcare costs. And proven routes to achieving this involve a central role for governments as both funders and providers of this healthcare, a focus on comprehensive primary healthcare, training and recruiting sufficient healthcare workers, predominantly women is what we're seeing at the moment, and crucially removing user fees for people for access. We know that aid and other forms of government spending on public healthcare systems is transformative in this context and saves lives. But regardless of these facts, rich countries are pushing this narrative that the private sector can act as a silver bullet to achieving universal healthcare and to broader developmental outcomes. The reality is billions of dollars in development financing going via these private equity firms, which are further obfuscating lines of accountability and manifesting in investments that aren't reaching the people that they're purporting to reach. That's why Oxfam's calling for an immediate stop on investments of development finance institutions into private healthcare provision and an urgent inquiry and investigation into current and future investments. What we need instead is investment into public healthcare systems that are accessible, equitable, affordable, gender transformative, and genuinely reach the people that they're claiming to reach. There is no private sector shortcut to achieving this, and the longer it takes for us to get there, the more suffering and the wider the gap in access is going to become.
Thank you so much. You talked about and you talked about how expensive it is for most people in low-income countries to access healthcare in some of the hospitals, private hospitals. Is there an initiative for them, or like insurance scheme that people in low-income countries can use in order to access the healthcare in some of these hospitals?
So this is what we're told when we've taken these allegations to development finance institutions and we're saying these investments aren't reaching people on the lowest incomes. They point us to these government health insurance schemes and they say, yes, this is how people can access this kind of care. But what we're actually seeing is, in a number of cases, people having their insurance refused by these hospitals, either being denied care up front or having it refused after the care has taken place and they're left with impoverishing fees. So I can give you an example. One woman we spoke to, the cost of her mother's treatment cost the equivalent of hers and her father's combined income for 7 years after she had gone through the process of this care. So it wasn't a case that the treatment was denied, her mother was cared for, and at the end of it, they were lumped with this unbelievable fee that meant they had to sell their land, they had to borrow money from friends, from family, and ultimately she was unable to marry the man that she loved. It's a hideous case, and it's not unique. So whilst these private health insurance schemes may be profitable for the hospitals, they are not the equivalent of accessible, affordable public healthcare schemes. They are not providing the access that development finance institutions would like us to believe that they are.
Thank you so much. And that brings me to another question to Nick. And we've been talking about intellectual property, and we've had the minister also talks about it. And my question is, pharma monopoly through IP rules the only way to ensure medical innovations as pharma companies claim, or are there other ways to access these services when it comes to, for instance, when she's talked about talking about the expensiveness of getting the drugs, vaccines, are we going to talk about only the IP as a way forward, or is there other way of accessing this?
Well, I'd say not only is it not the only way, it's not in any way an effective way of producing innovative medicines. I mean, I've been researching a book on this, which is coming out in a few weeks' time, and the most striking thing about that research for me was learning that pharmaceutical corporations today do not produce medicines. They don't produce new medicines. They invent or create new medicines. The medicines that we have today are created with taxpayer money at universities, by public scientists, or by small biotech companies. And the business model for those small biotech companies, when they create medicines, is to simply get bought out by a big pharma giant. So the big pharmaceutical corporations today, they would like to convince us that what they like. Okay, we accept medicines are very expensive, but that's because they're expensive to create. That's what they tell us. But imagine, without us, you have no medicines. That's their message. It's a lie. It's not true. Essentially, big pharmaceutical corporations today are hedge funds, buying up and speculating on, in many ways, the intellectual property that's been created elsewhere in society. And that doesn't make any sense. It doesn't make any sense for us as a society to treat knowledge in that way. We're told we live in a knowledge economy today. Why on earth do we allow knowledge, which has been funded with our tax money, to be privatized, to be enclosed, to be monopolized in this way, so that a handful of extremely rich people can make a lot of money off it, rather than using that to collaborate and to further the understanding of humanity, to be able to treat diseases that should no longer be a problem in the world. And I think, to make a link with what you were saying, the exact same thing applies to climate technology, because the disaster, the catastrophe that we experienced in COVID would be as of nothing, unfortunately, compared to the disasters people are already experiencing in countries like the Philippines. But it's only going to get worse, as we've seen this year. How can we as humanity think that it is acceptable that the knowledge we need to get us out of climate change, to halt climate change, to mitigate and help countries adapt to it, that it's acceptable for a handful of small corporations to privatize and close and monopolize that knowledge? That's wrong. And so we need to change the rules of the global economy. We need to change. They've been written to benefit the few, and we need to change them so that everybody can benefit from the technologies and the scientific breakthroughs and that happen.
Thank you so much. And again, before you leave, Nick has just talked about changing the road for everyone to benefit. What lessons or learnings do you think the health rights movement would take from the climate justice movement?
Well, everything is connected. COVID-19 showed us that everything is connected. If we will not take care of the earth, there will be more pandemic. If we will not take care of the planet, there will be more problems that maybe even our scientists are not prepared for to study. And that is why we have to come together to solidify our all efforts, because when we talk about health justice, when we talk about gender justice, when we talk about social justice, it all boils down to climate justice. Because whatever we do to our earth, even if you are in the US, you will be able to experience, you will be experiencing the effect of climate change. And that, in in the future, because just look at what's in your fridge right now. Those are from a source that is being threatened by climate crisis. Our food is not anymore safe. They are already being contaminated by pesticides. Even if we go to Harris Teeter or wherever you get your food from, you cannot say that the vegetables that you get from those grocery stores are actually healthy. So in no way that we can say that we have a healthy food, right, as of the moment. So everything we do, it all boils down to how we take care of our earth. And so if we will not take care of our earth, if we will not have the policy to make sure the developing countries will be able to get back better every tragedy, we will not be able to solve all the crises that we have in this world. So we have to be together to solve the climate crisis, to have climate justice, and so we will have a health justice.
Thank you so much, and I know you have few minutes. If you could just give us your parting shot, because I know you have like less than 5 minutes today. What do you think is the way forward and solutions that we should always look into so that we don't see a repeating of such in future?
Well, we keep being activists. We keep asking for accountability from our leaders who are here right now, from the big corporations to change their business practices. Because if, again, as I said earlier, if our world will collapse, everything will collapse. And so I think the way forward is to ask for a policy that is representative and would address the crisis from around the world, not just benefiting, not just with benefit a few people who are rich, who can have the resources, but is actually accessible to the developing countries and to countries who are far away from the US, like AKA Philippines and other countries in the global south. The way forward is for us to solidify, to be together, because this is not you and the us problem or you versus us problem. This is this is our problem. And the US is already seeing a lot of heat waves. And that also can lead to a lot of serious illnesses. So these are all connected. And so we have to be all on board.
Thank you. And that brings us to, thank you so much, Marinelle. Thank you. Enjoyed the rest of the discussion. And that brings us to our Q&A before we give our panelists to say way forward on some of the discussions and give anyone in the delegates who have a question.
Yeah, thank you, Mr. Onesmo from Tanzania Human Rights Defenders Coalition. Yes, I appreciate you for this initiative, especially talking about our health as a human right. But when it comes to pandemic, it seems there are people who are making money, who are becoming rich out of all these health challenges we face as human beings, especially the pandemics and any other diseases like malaria, HIV. That the problem we have in our community, there are people who are becoming rich out of it. And if this continues, some other people might actually decide even to create problems, diseases, pandemics, for the sake of creating some other billionaires and billionaires. Now, what should be our role now? I'm asking you. Just convince the UN sometimes to make issues of health as a service to global citizens, not as a business. If there's a pandemic like COVID-19, let the UN, WHO take the role of creating whatever kind of vaccines, medicines, and offer all the people around the world without making it as a business. We should have to stop making vaccines and whatever kind of medication to end pandemic as for business. This is the only way we can create the global society safe from whatever kind of creation that diseases, pandemics, and other things. Because some people might sit down and create pandemics so that tomorrow they can rise up and become billionaires. Yes.
Thank you so much.
the fundamental problem on the two issues about access to medicine, the role of pharmaceutical companies, access to healthcare, the role of commercial sector, not just private sector, but commercial sector. So that behind that, or below that, or the fundamental thing for that is how society look at healthcare. So, and how society look at people. So if you look at people as consumers, then fine. Because then, if you have money, you buy Coca-Cola. If you don't, you don't buy it. No problem. You're not going to die if you don't buy it. If you have money, you buy medicine, or you go to five-star hospital. Well, by the way, five-star hospital doesn't mean equality, at least in developing countries. But anyway, but if you look at people, citizens that have rights, then you treat them as citizens who have rights. Then you think as a government, you provide health service, and you control the way medicine is produced and sold, so that this delinking, cut the link between financing research and development and pricing and supply of the product. And that's what pharmaceutical companies hate. They hate the word delinking, they hate the word transparency, and they fight against it. Hence the work that South Africa did on transparency goes far beyond than South Africa. So that's on one side. And until society looks at pharmaceutical companies and private companies as not producers of health and health products, but we need other ways of producing, we will continue with the same thing if that doesn't happen. You can't really talk about access to healthcare, universal health coverage, without saying and the private sector. It's almost blasphemy is the right word. I don't know how to pronounce this word. But anyway, it's almost like that if you don't mention the private sector. And I was told in many occasions, oh, and the private sector. And I say, no, we're talking about public-public partnership. Public governments, public people or communities or civil society, whichever appropriate at the time. That's the partnership we're talking about in this particular. No, it's public-private. And we have to really, really overcome that feeling that you can't live, you can't produce health, or healthcare, you can't produce medicine without these companies. Will control the companies, so they produce it and make profit. I mean, I'm not anti-profit, but I'm anti-obscene profit. But for health, for providing healthcare, it cannot be private. And I just want to congratulate you, Harry, and Anna-Maria, on a fantastic piece of research. Really, if you haven't read it, it's well worth reading. I'm so glad that Oxfam is still swimming against the tide, because you are swimming against the tide with this report. Nobody accepts that you can't provide clinical care without private sector, and you say no, it's dangerous. So well done.
Thank you so much. Any other questions before we have our panelists respond to the two questions? Oh, sure.
Thank you so much. My name is Joe Mukanda. I was just reflecting, the momentum that we had during the pandemic. How do we build on that momentum to mobilize the global south of developing countries, to build on the anger that we experienced during that time, to make sure that we actually dismantling this system that works against us. Right now, many of the leaders in the global south are not talking about the role of the big pharma. And then also, we understand the structural traps that have been laid against the global south, not to be able to produce not just vaccines, but also not to be able to feed itself, not to be able to educate its own people. The climate crisis, as we talked about, this narrative that we also saw that during the pandemic, we're in this together. It's a common problem. And
And I'm asking myself, to what extent does that narrative of we're this together work against those who are impacted most? Just some reflections on that narrative. Yeah, of course, it's the narrative that's being advanced in the climate crime, in the climate discourse, in the sense that it's our responsibility, all of us, that, for those who followed, for example, the climate summit in Nairobi that was organized by the Global North and held in Africa, called an African Climate Summit. That was the narrative. There's no North versus South. There's no issue victim. So that kind of narrative has also had it here. To what extent does it prevent us from dealing with those structural issues and calling out those who are responsible?
Thank you so much for that. And now to bring to our panelists, you'll help us answer these questions. How do we build on momentum and dismantle system that works against us? And also, what is it about making pandemic a business? And the transparency, whereby she talked about pharmaceuticals, hate transparency, and talking about overcoming the feeling that we can't produce our own drugs.
Thank you. So, taking from the top, I think the question on building momentum is very relevant. And as an African, maybe I'll start from that angle. I think as a continent, I'm speaking as an African, as a continent, I think we've also found a lot of comfort in the global north coming to our rescue. I think while I do support global cooperation and solidarity, I think African countries and especially our leaders must also begin to invest in medical and clinical research and infrastructure. These are things that have been missing. While governments collect taxes, this money is not being directed towards research institutions or research facilities for public production of medical countermeasures. So if we're trying to build on that momentum, the same statement that brother used, that the anger that most poor countries felt, because the reality is when the pandemic strikes, every country will have its own population as a priority. COVID-19 taught us that lesson, harsh as it was. And the MPOX recently also reminded us the same lesson. When push comes to shove, it's going to be every country trying to make sure it protects its citizens. So if poor countries are also not taking, even if it's just baby steps towards investing, then how do we adequately argue on ensuring equity? How do we adequately argue that we are doing our part to protect our citizens as poor people, instead of always folding our hands and waiting all the time? And then beyond that point, I think there's also a great argument that medical research, medical R&D should not be business models. And I think that's why maybe earlier, when I spoke earlier, I mentioned that we should be thinking less about the numbers and more about the faces behind those numbers. The people, the families, the children, the mothers, the fathers, the grandparents that are falling victim, that are dying as a result of our negligence as governments, as a result of negligence as a people, as civil society, trying to hold governments accountable. We need to keep the push, hard as it may be, we need to keep that push going, because if it is left without checks, it's true that most of the corporate pharmaceutical companies will continue to get richer, and most of the diseases that are very, very common and preventable in the low and middle income countries will continue to be neglected diseases, because they don't provide a good enough profit for big pharma and their shareholders to invest in. So this argument has to be pushed real, fast, and hard.
Thank you so much. And to me, big farmers making business from pandemics or crises.
Oh yeah, I mean the chief executive of Moderna became a multi-billionaire because of a vaccine that was 100% created with public money. And several members of his board became multi-billionaires too. Pfizer in 1 year made $50 billion of its treatment, antiviral treatment in its vaccine. So yeah, it's a huge industry. But I agree with you. I think if we're to get out of this, countries simply need to start doing things differently. And I think there are some hopeful shoots. So the mRNA hub in South Africa, we've already heard about. Right? Went to Pfizer, went to Moderna. Can you help us? No, go away. They just did it anyway. They cracked it. They proved that it was possible on the African continent to make mRNA vaccines, and they're now using that to research TB vaccines. And the really radical thing is they are then saying, we will share this patent-free with the countries and factories around the world who want to make it. So we really hope that people build on that. That's an amazing example, but it's only one example. Build on it. And also, we as civil society need to keep pushing to radicalize that model too. There's amazing stuff in Brazil in terms of public manufacturing for their national health system. Even here in the United States, there is now such a crisis in terms of access to medicines that President Biden is taking action. He's at war with the pharmaceutical industry. He's saying, I will negotiate the price of these drugs down because you're profiteering. In California, they're about to start public manufacturing of insulin because 1 in 4 American diabetics have to ration their insulin supply. So that's even happening in the United States. So I think our job as activists is to support, is to nurture, and is to push for those examples, but then to come together to fight against the rules of the global economy, which are impediments to these things. We have a global economy whose rules have been drawn up to turn everything into a market, exactly like you were saying. Everything that we care about is only so many commodities, and we are just consumers. That's what we have to fight against, because it is that model that's created so many of the problems we face today. In COVID, in the climate catastrophe, in the rise of populist authoritarian leaders around the world, this idea is central to the problem. And so I think that the big push we've got, and what the leadership behind me should be talking about for the entire 2 days they're here, is how we transform this. If we still want to have a livable planet and a fairer and a more sustainable planet that's going to take us into the next generation.
Thank you so much. And to graduate and Harry, how do we dismantle systems that work against us?
Well, it's something that I guess that the questions here actually we're talking about is we need to mobilize and organize ourselves. And in that, I guess that the People's Vaccine Alliance is an example of that. During a very serious moment of our lives with the pandemic, this alliance was organized and many movements were working towards the right to have access to vaccines and to save their own lives. And then we were able to have 3 regions working from the regional level. For example, I have here my colleagues, Sofia, Marina, Lidice, Natalia. They are leading the work of PVA in Latin America. We have 3 working groups that they are leading. For pandemics, on challenging the intellectual property, and then on advocacy work. And also from Oxfam Lab, we have produced 2 reports, one at the beginning of the year about the unequal impacts of the pandemic, and now we are just releasing one called the Human Debt, about how we are going to pay for these vaccines that generated so much profit for these pharmaceuticals, while the society will have to deal with austerity, with reduction of rights, including the right to health, to pay the debt that was necessary to pay them. So that's an entire harmful cycle that we are living at. So when we fight for transparency, as Fatima was telling us, and we are able to have the information, we are able to challenge and change this process. And that's where we are now. So I believe that the work that PPA is doing, that many civil society organizations who work with grassroots movements, for example, this report that Oxfam Lab did, it was made with grassroots social movements in many countries in Latin. And they were able to find out, for example, in Guatemala, Honduras, and Peru, it was the indigenous population who were among the last ones to receive COVID-19 vaccines. In Colombia, the migrants were the last ones to receive. Actually, they were treated as if they were not human beings, just because they were migrants. In Mexico, it was the people in the rural area who were not able to get vaccines. In Brazil, the black people were not able to get vaccines. And they are the majority of our society, and I'm Brazilian. So it's scary to see how these persons who are so important in this society are being excluded. But when we make this process visible, we have the chance to transform it. Ari, can I just say one thing, please, about how we can? I'm sorry, I just have to say that. What do we learn from the HIV movement? In 2001, I wasn't that building, there wasn't that horrible security. It was the first UN General Assembly session on a disease. It was on HIV. And you walk in, and this huge, gigantic picture of an African woman on a bed, obviously dying, and somebody is holding her hand, and the logo, whatever, the caption says, "You mustn't die alone." And I screamed inside. I really wanted to scream outside. It's "you mustn't die, full stop." It's not about alone. We talk in 2001 was medicine, antiretrovirals were available, saving lives. But of course she's African, her life was at stake. That fundamentally changed forever. We have treatment now. Most of the people in HIV, not everybody, is on treatment, something we didn't dream about. Why did that happen? It's not because companies suddenly had a humanitarian concept or governments. I remember looking at the UK government and what we hear, even NGOs. I was told people in Africa don't have water and food. That's more important than medicine. The government in the UK used to say, but we can't fund people forever. But of course, they could fund them because the price came down. So that's what we need to revive. And thank you for mentioning People Vaccine Alliance. This is a revival of the HIV movement. And a big part of it is the HIV movement. We should really not forget that lesson. We can make change. We can change these corporations. We can change the way government just follow these companies and don't challenge them. We can do it.
Thank you so much. The lady in white coat, she has a very funny comment to make.
My name is Luana. I come from Brazil, and for me, it's been very rich experience being here. I'm here because my husband have a hyper-rare disease in the ear. This disease makes him feel the worst pain in the world. Registered by medicine. We took 7 years to know what happened, to know the diagnosis. We needed to go to Germany, and we did everything alone because our country do not have a policy for rare disease. We studied a lot. Every day in my life, I live for saving my husband's life. And I know that my pain is the same pain of 300 million people in the world. Because this is the number of people who has rare disease. People who has rare disease are people that for that. And the only place in the world that has the treatment to save my husband's life, this beautiful guy here, exists in Connecticut, just a few hours over here. There is only one doctor in the world who has a research that explains his disease. And even we showing everything for the Brazil government, all the research, all the doctors, international doctors saying that he needs this treatment, all the process and the justice and the administrative process was negated. We're talking about many people in many countries who don't have the human rights. It's a new problem. And I'm here to ask for help for everyone who's passing through of it. And especially for my husband. Because I was talking with the minister of the representative of minister of the Brazil that we don't born activists, we become. I never thought that I would be an activist. But today, my life, it is it. I fight for my husband, and today I fight for everyone in Brazil because we did a new policy with the public defenders to use the money that the government has to save these lives. Because when we say that people with rare disease don't get big treatments because the government doesn't have the money, it's a lie. In Brazil, every year they give it back 3 to 4 billions of reais because they don't use to save people with rare disease. So everything that you in the table said about the importance of transparency, it's what we stood here in this association. It's something that can change the government mind because they need to know that we know the truth. And when we all watch TV and when we read article news, this information are not there. I only know this because I'm suffering a lot and I needed to study and to go to reach this information. But in every meeting that I had with the health minister of Brazil, they didn't know this information. They started to change the speech because they saw that it was true. So I'm here because sometimes new problems need the strength of many countries, of many people around the world to be solved. And if people that are hearing me could do something to call the attention of my president, Luiz Inácio Lula da Silva, to save Rafael's life, I would be very grateful because I know that there are many other Rafaels.
Thank you. Thank you so much. And thank you for the participation. And just to wrap it off, have our panelists say, like, in a few words, what are some of the solutions and moving forward, what do we look into?
Yeah, I think we've had some really powerful testimony today, some really incredible examples of the importance of this, and also some really eloquent responses as to why this narrative of we're all in the same boat isn't true. We've been told this throughout the pandemic. We're all in the same boat. We're not. We're all facing the same challenges, but we've all got vastly different boats. Some of us are in catamarans and some of us are in leaky canoes. So I think we need to keep challenging this narrative that we're all in the same boat and accept, as Nick, as Marianelle pointed out, there are people that are really benefiting from ongoing health crises, from the cost of living crisis. Oxfam's doing incredible work around taxing these people and trying to redistribute this money to get the money where we need it, to achieve universal health coverage, to achieve a high standard of living for everybody everywhere. And we need to challenge this narrative, as Moga very rightly pointed out, that the private sector is the key to doing this. We've seen it's not the case of a few bad apples. That's what we keep being told by the development finance institutions, by wealthy governments, civil society. You focus on a few bad cases. We're not talking about a few bad apples, we're talking about a rotten tree. And we need to replace this system, this insidious private sector first system that has hijacked the development agenda with universal coverage delivered by public, accessible, affordable, gender transformative public healthcare systems around the world.
Thank you so much, Harry. Jose?
Thank you. We need to make sure that we have transparency and that we have social participation, and that civil society is able to speak to those who are in power. For example, now we should have more spaces there. What we're saying here was supposed to be heard over there. So we need more of this, of social participation and openness to hear us. We need economic justice, we need fiscal justice to properly finance rights, the right to health, the right to education, because it's there in the universities where the research and the development is being done and then appropriated by the pharmaceuticals, for example. We need to finance other rights. We need to, in this way, tax the rich, tax wealth, and tax corporations. And we need to promote the full release of patents on vaccines, treatments, and tests. We need to challenge the IP, the intellectual property. Just some of the main challenges we have ahead.
Zachary?
Thank you. So I think from my perspective, number one, when we do civil society work, we are not only calling against the bad things that are happening in global health access. We must call them out. We must campaign vigorously, energetically, and sometimes angrily at some of these wrong things that are happening in global health. But at the same time, we must also lay an easy path for the few researchers, few institutions, few organizations that are working to make things better. Nick mentioned the mRNA Tech Transfer Program that is happening in South Africa and 15 other countries in the LMIC regions. Those initiatives require civil society support. We need to create the ecosystem that allows the few ideas that are working different from big pharma to find an easier path going forward. So our advocates should not only be opposing the bad, but also supporting and advocating for positive movement for those that are making things work, or at least trying to improve things. The future of health rights don't end in Europe and America. When we talk about the future of health rights, it's for every single person who is on this planet, regardless of the continent, regardless of their origin, regardless of their means in life. Everyone deserves access to health as a human right.
Thank you so much. Nick?
Well, my simple message is don't give up. There's so much anger and passion and enthusiasm in this room. There are so many people, as Moga said, from going back to the HIV pandemic in Southern Africa, who fought against the fact that millions of people were at risk of dying and did die and suffered, despite the fact that we had a medicine that could have given them to prevent that suffering. They fought against that and they changed things. And without them, I think we wouldn't have had the people's vaccine movement. I think we wouldn't have had the movement that we had in COVID. We were really standing on the shoulders of giants there. So I want to thank everybody who was part of that movement. And we now need to stand on the shoulders of what was done in COVID and create the better world that we're all talking about. And don't give up, because this is how we're taking on big interests here. We're taking on vested interests. It's huge. The structural structural change we need to make is enormous, but we have to do it. So keep going, because it's you who's going to create that change.
Thank you so much. What a fantastic way to end our discussion today. Keep going, never give up. Thank you so much, panelists, for finding time to be with us today. Thank you, everyone who joined us both in online and physical, and a round of applause for our panelists.